The opioid epidemic took a backseat to COVID-19 when the pandemic hit.
But that doesn't mean the problem has gone away. Health experts are looking at ways to decrease the ongoing problem of opioid abuse. News 3's Danny Valle has more.
The opioid crisis hasn't left. In fact, it's taken more lives in Illinois. In 2019, the state recorded 2,219 deaths from opioids. In 2020, that number increased to 2,944 deaths, a 32% rise. Those numbers are prompting experts to find new ways to combat this crisis.
We know 20% of those people who have exposure to narcotics are going to become an addicted person, and they're going to have ongoing issues with that, such that we have not only enabled that, but potentially caused a lifelong issue.
Dr. Brent Jones, a family physician at SIH Primary Care in Harrisburg, says areas like southern Illinois are an opioid treatment desert.
You have no one in a whole county, for instance, and there are a lot of counties in southern Illinois where that's still true. We're not going to see much of this happen, so you're not going to have much change in your overdose levels because there's going to be a lot less Narcan prescribed.
Illinois State Police Director Brendan Kelly says the goal is to save lives and reduce harm. That can be achieved, he says, by having someone assisting an officer with opioid calls.
Professionals that have a social services background, that have a medical background. Law enforcement doesn't want to see the same addict over and over again, suffering and being put in very dangerous situations. We want to see them break that cycle of addiction.
James Sparks, a former addict, now a behavioral health care manager, says it takes strength to fight an addiction. And the more help offered, the better an addict's odds at overcoming.
Whether we started out with somebody with chronic pain and have become addicted, we look at where that change initially started and try to get back to the normal mindset.
Danny Valle, News 3.
The group made 3 recommendations. Those include increasing remote learning and virtual treatment services, sustaining and expanding harm reduction services, and engaging justice-involved groups to reduce opioid use.